Hi, I'm Dr. Sam. I've coached thousands of patients to bright, clear skin at my Harley Street clinic, and I'm here to help you too. Now, we've been talking a lot about acne the last couple of weeks, but today I wanted to get down to the nuts and bolts of why treatments sometimes fail. What is it about treating your blemishes that sometimes leads to complete abandonment? Just, this is not working for me. I don't like it. It's not the kind of solution I want. And just to kind of share the objections I've often heard from patients and the information I shared with them to turn that around. Sometimes taking action is scary, but sometimes the reason we're not taking action is really just a practical problem that can be easily solved. So today I wanted to meet those kind of objections head on. So when we talk about a blemish solution, or spot cream as perhaps it's more conventionally known, we're talking about the step that helps take down the redness and inflammation in a new blemish, the kind of thing you would use when you've got like a monster coming up just before your period. Now, that is one part of my 5-step approach to blemishes. You've got your basics, your cleanser, your moisturizer, your SPF over here. You've got your anti-inflammatory, and you've got your preventer. So that's the 5 components that I think make for a successful approach to solving breakouts. Now, because your preventer, which is usually a retinoid, goes on the skin at night, your anti-inflammatory, your targeted spot treatment tends to go on in the morning. Now, of course, anything that's part of the morning routine can cause havoc if it doesn't apply well. So the first problem that you tend to run into when you're using a morning-based blemish solution is that it can cause some dryness. Now, there are hardly any actives that are useful in breakouts that don't cause some degree of dryness. Perhaps niacinamide is the exception. But the majority, so whether it's benzoyl peroxide or salicylic acid or even azelaic acid, will tend to cause some redness and dryness in themselves at the beginning, and this can cause problems. So when I was a teenager, I remember distinctly using 10% benzoyl peroxide, lovely quinoderm, which created a sort of pothole where I put it in treating spots. And of course I didn't know any better, so I didn't treat the zone, I chased individual blemishes. And basically it disrupted my skin so much that there was no way the rest of my morning routine would go smoothly. So the good news is something as simple as buffering can make all the difference to whether or not you can use a treatment and the rest of your morning routine successfully or not. And that is the simple step of applying moisturizer to the skin before you apply your blemish solution first. And that doesn't stop the blemish treatment from working. So many people get concerned that they're somehow blocking the effect. All you're doing is preserving the barrier around the blemish. Bear in mind that most blemishes are already ceramide deficient, so they're already predisposed to getting irritated. So you're actually just shoring your skin up nicely by using moisturizer before your blemish treatment. So the next most common objection I hear is that they're messy. So yes, a blemish solution is another layer, but I find that increasingly with better formulations nowadays, with a nicer vehicle, meaning things like squalene or silicones are used, you can get a much better smooth layering effect that allows you then to apply moisturizer, sunscreen, and makeup easily on top. And again, if you apply a spot cream or blemish solution correctly, you should be, generally speaking, treating a zone. I think the problem arises when you pile on too much product onto a single blemish, and then nothing can really adhere to it after that. So again, treating your blemish zone correctly will help avoid you overloading the skin and then making the rest of your routine unworkable. Then the next objection tends to be that there's difficulty with applying cosmetics over the top. And I personally have experienced this before when using something like Duac, which is benzoyl peroxide and clindamycin. It's a combination treatment on prescription, but it can be a bit wet. So again, here's the thing, don't overload the skin, don't apply loads of product. It's amazing how sparing you can be with these kind of things. It's why I'm always really specific about the way I measure out for patients how much they should be using to treat a certain zone of the face. So for example, half a fingertip or a pea is more than enough to treat a T-zone or a U-zone when we're treating parts of the face that are blemish prone. Again, a full fingertip, which is just a line as long as your finger, is enough to treat the full face, whether you're using a retinoid or some other product that needs to be applied all over. So that's the first thing. Don't overload the skin with too much product. The next thing is allow time for layers to dry. Now, this is obviously common sense, but it is quite an important thing to build in practically, whether it means putting on your blemish solution, brushing your teeth, or going and making a cup of tea and coming back. It really will make a difference, allowing things to apply smoothly and importantly, avoiding pilling. Then there's the group of non-believers, those who believe that their products aren't working. And I think this is because we've all been led to believe that treatments should act overnight or in a matter of hours, when in fact, a blemish solution in truth takes weeks to months. So it's all about managing expectations and looking out for the early warning signs that things are actually changing. Now, that might be something as simple as your blemishes don't last as long. That's a really key early pointer that things are going in the right direction. You're getting new blemishes, but they're not lasting as long. That also means is they'll be leaving less pigment behind. And then over time, generally speaking, what I see with my patients is they're getting fewer and fewer blemishes as things go through. Now, in terms of the initial effect, sometimes you get a bit of purging. So sometimes things can look worse before they get better. Again, if you're forewarned with that knowledge, then you're forearmed and you're likely just to ride it out. So I always encourage patients to give it at least 3 months before coming back to see me, because it's really only through being exposed to your creams for 1 to 2 skin cycles or 6 to 12 weeks that you really start to see that transformation take place. Now, the last objection I hear that's a common one is that benzoyl peroxide bleaches things. And, that means the odd towel has gone by the wayside or pillowcases have been destroyed. So if you want to avoid the bleaching effect of benzoyl peroxide, if you love wearing black and literally found that it's ruined too many pieces of clothing for you, then the way to go is salicylic acid, azelaic acid or niacinamide, or even a combination of those ingredients together. So the key thing is don't abandon hope too early. Have realistic expectations and milestones so that you don't push your skin too hard, that you'll realize that with time, even if it's a subtle thing, it does get a bit easier, and that with consistency comes results. Sometimes it is a small objection like these that I've covered today that gets in the way of you solving your breakouts, and I really hope that I've given you some ideas about solving them today. And if you found this video helpful, please share it with somebody who needs this content, and I'll see you again very soon. Bye for now.